it's a sort of nice segue to introduce Shinjini, who's here. And Shinjini comes from Translational Health Sciences Technology Institute, where she's a distinguished professor, a trained gastroenterologist, pediatric gastroenterologist, but moved into clinical research, where she is leading one of the largest cohorts, maternal and child health cohort called Garbhini, funded by Government of India. So I'll hand over to her to sort of introduce how like as Ashok said, Gagandeep and Shinjini were introduced to us, and then how that introduction sort of has bloomed this healthcare domain for IBSC and RBCDSAI. Shinjini, over to you.
Thanks, Himanshu. Thank you. Good morning, everyone, and thank you for having us here. The team is here, so I actually am going to talk about our work representing the team. Ashok, thank you, if you're still there, for making this introduction, because I think we've come a long way. This started in 2015, our introduction to Himanshu and Karthik, and we've made a lot of progress since then. So I'm going to give you a little background as to where we were and why Ashok thought it was a good idea to connect us, and then where we moved from there. One of the things that I would like to highlight what he said is about data and how the data needs to be collected for it to be used effectively as we move forward. And I think, so while they're loading the slides, we are pediatricians, and so we're a team of pediatric gynecologists, and we were always worried, have been worried, that despite everything in this country, the perinatal outcomes continue to be dismal. Both the maternal mortality, the infant mortality, and a large part of this mortality comes from babies dying at birth, and these are either dying at birth or soon after birth. And one of the some of the common complications are being born too early, being born too small, or having infection because they've been born too early or been born too small. So around this program, yeah. So maybe you can so to save on time, so because of this, Department of Biotechnology, and Ashok mentioned Professor M.K. Bhan, who was Secretary, Department of Biotechnology at that time, being a pediatrician himself, supported us to start this very large program, which has now become a flagship program of THSTI and Department of Biotechnology, which is called Garbhini. And this stands for, it's an interdisciplinary group for advanced research on birth outcomes. And the mandate of this program is to use multidisciplinary across different institutions to solve a problem which has public health significance. And we've used, so as you can see here, it's essentially integrating clinical epi, advanced biotechnology, and data science to improve pregnancy outcome. And the mandate is to look at epi understanding of birth outcomes, which can inform clinical practice and policy, ultrasound and AI-driven tools for personalized prediction of birth outcomes, and this is where we will spend more time today, and multi-omics biomarkers to provide customized clinical decision-making tools. Now, these are ambitious objectives and outcomes. How do we go about it? And this can't come from just small hospital-driven studies. We had to look at a larger platform, and therefore we set up a large cohort with a vision to have 12,000 pregnant women to look at different clinical evaluations and be able to collect this large data, which Ashok was talking about, have it well curated, so that we can actually create a platform for our data science collaborators to work on. And with that, and as you can see here, our mandate is tools for early prediction and prevention of adverse pregnancy outcomes coming from various parameters as I just mentioned, and also along the way look at pathway analysis. So this is a very comprehensive concept of what we are doing. And one of the big programs is AI-driven tools, and that's what I'm going to talk about. Well, not me, one of my colleagues will be talking about later. But just to give you that the Garbhini cohort is in a small district hospital in Haryana, and we are following women from early pregnancy at birth and a few months after they've delivered, and now following up the babies for 2 years after birth. So we have a very comprehensive longitudinal data collection of these women at different time points, which includes very detailed clinical phenotyping. So this is, you have all the details of the mother and the baby now, along with biospecimens, and which includes various kinds of biospecimens, and then we have the ultrasound images followed across pregnancy for the fetal growth and the uterine parameters like the placenta and the uterine cervical structures. So at the moment, as of today, we have 11,000 women enrolled in this cohort. We have some more funding till about 12,000, but we're hoping to keep this going because this has become a national platform and we feel a huge wealth of information can come out of it. So the AI strategic framework. So before I come to that, that's where Ashok mentioned, because of this Garbhini cohort, I remember when Himanshu and Karthik came to meet us in THSTI, and we talked about this whole data set and how we could have data science collaborators. So we have people from, we have scientists and collaborators from National Institute of Biomedical Genomics. We have from regional center who look after the genomics and epigenomics work. We have collaborators in Regional Center for Biotechnology for our proteomics and metabolomic questions. And then we have now Himanshu and his team collaborating on the data science. And fortunately for us, we have physician scientists like Ram and Condi who will be talking, who got immersed in this. And I now remember when Himanshu and his team went to the district hospital, and that's something I want to tell the younger colleagues here. Don't work on data without understanding where it's coming from. And that is absolutely crucial, because that is where you understand what you're going to actually come out with, the application. That application has to go back to these people where you got the data from. Sitting on your computer and crunching some keys is going to give you a lot of excitement, but that excitement will be 10 times more if you know where this data is going to be applied. And that is why we thought it was important to introduce to you one of the examples of how this data has been created. I don't know, is the film there? Okay. I don't know if just very briefly, you know, Himanshu and his team is like 50% child health and maternal health people now. They know all about period of gestation. They know what a preterm birth is. So this is our district hospital at Gurgaon, where the data is being collected from the mothers. It's all electronic. It's collected on a tab. The data is transferred real time to THSTI. We have a biorepository, which is again electronic from end to end. We have exact information of what samples, where they are, how they can be retrieved. It's been a big challenge, but I think today we are in a position where we can say, okay, we are ready to collaborate with more people, with younger people who can come and ask questions on this data platform. This is THSTI, and an aerial view. So, of course, it's not just THSTI, as I said, we are a partner group. So coming to the AI, I'll stop here because Condi is going to be talking more. But today we have ultrasound images of almost, how much, Ram? Almost 700,000 ultrasound images longitudinally across pregnancy. And now we'll be starting images across birth. And from those images, we've been able to develop dating tools which Condi will be talking about. From this data set, in collaboration with Himanshu and his team, and with Condi and his work on India Alliance, where we've got tools which we're now ready to validate and take further. So this was just one example, and all the best, Himanshu and the rest of the team. And thank you, Ashok, again for connecting us with IIT Madras and the team. Thank you.